Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get to the $2 million mark and beyond. So I'm going to start with this great question that a younger doctor just asked. He recently finished probably residency in private practice, and he said, "Hey doc, should I stop doing surgery? Or realistically, is the value from surgery in the private practice worth it?" So what I've noticed is, so first of all, my disclaimer here, I did a 3-year surgical residency. I do not do that much surgery. I don't think I'm the best at it. I don't really like doing it. I lost a lot of sleep worrying about the cases, and so I choose not to. I have another 3 doctors in my practice that are very, very good surgeons, and they don't mind if I refer to them. So I'm going to talk about kind of like the ideal today, and maybe something that might work for you. So I think, number one, if you don't like doing surgery, I don't think you should do surgery. If you're not good at doing surgery, I don't think you should be doing surgery. But I think it's a hard thing with our ego and with our training as podiatrists in our residency. So like our residencies, all I did for 3 years was do surgery, and now all I do in practice is see patients in the clinic and not do surgery. And maybe it's the type of practice that I'm in. But this was a hard thing. Like, it was humbling, really, really humbling for me to go and say, hey, maybe I don't want to do that much surgery, or do any surgery, or specifically pick. So what I've done over the years, the first thing I did was lose a lot of sleep. So lose a lot of sleep is what I meant. I was doing cases maybe that I wasn't prepared to do from residency, thinking, oh, I should be doing these for my boards, or I should be doing these because I'm a podiatrist and I should be able to do all this stuff. So that took me quite a few years to learn. And when I struggled and when I lost sleep, I said, hey, I don't think I really want to do this anymore. And so what I did is I made a list of all the surgeries that I felt confident with and I didn't have difficulties with. So I made this little list, and I called it my surgical list. And it had some things like an Austin bunionectomy, hammer toe, different types of things like that. Simpler 4-foot procedures, maybe a Haglund's that I felt okay with. And that was my list. And so then I said to myself, well, you're only, Don, going to do these ones that you are comfortable with. And I kind of liked doing some of those cases. Mostly what I liked, though, was teaching the residents. I liked working with residents. I liked teaching. And then even those, though, I found that I still lost sleep over. I was second-guessed and questioned, and I was like, what about this? And so as I started to talk with patients, I said, the first time it was really hard to do this. I said, there's some other doctors that do a lot more of this, and I think it would be best if you saw them. So like things that I wasn't that good at, like doing a first MPJ fusion or like doing a lapidus bunionectomy, I would send to them, and they gladly did them, and I was able to see other patients. So this is where I'm at right now. Is I currently refer out the majority of the cases. Some of the smaller ones I do, and I tell patients, well, basically I'm booked out about 6 months, which is true in terms of surgery because I don't have many opportunities. I maybe have 2 or 3 days a year that I do it, and then I put in a lot of the simpler cases that I'm used to. Okay, so if I was a young doctor starting out, and if you didn't like it, find someone that really does like it, and you could refer out to them for the surgeries, and maybe they could refer you something else that you like. For example, Shockwave. I have a colleague, he's in Texas, and he has a doctor that he refers to all of his surgeries, and this other doctor does sends all of his nail fungus to him, and he does like laser toenail fungus treatments for him. It's like, what a great trade if you like being in the office. So that's one thing. If you absolutely want to go into surgery, you might want to consider MIS, and even it's not the surgical procedures a lot of times that make the profit in what I'm seeing now. Is a lot of times it's some of the adjunctive therapy. So like it's the maybe this doesn't add that much, but like EBM has these to help with the bones heal better. You have Shockwave that can help the bone and the skin heal better. You have amniotic injections that can help the tissue to heal and have less swelling afterwards. You have the red light therapy, like laser therapy, that can help. So a lot of times they're making more on these adjunctive therapies or these different types of things that you're doing than the surgery itself. And you putting all this in a package can really, really help patients and help the profits in your practice. So if you don't refer out, consider doing in-office surgery or consider doing a surgery and then adding these things as add-ons to help this. If you don't want to add these things as add-ons, it's probably not worth your time to go to the hospital to do a lot of these cases unless you can figure out a way to do these other types of things to help increase the healing potential of these patients. Okay, so those are kind of my thoughts about surgery at this time. And I want to tell you the truth, though. It was really hard for me to come to the point of saying, hey, I think I want to have these other doctors. Now, thankfully, I have these other doctors in my practice that like doing surgery, and they're very, very good at it, and I respect. And I can lift them up. I can say, these guys are great. I think you should go see them. I think it's going to be kind of best for you. Okay, and that was question number 1. This doctor asked about surgery. Second question, they were asking about Shockwave. I get this question a lot. First of all, the question is, I heard that Shockwave is covered by insurance. Now, I think they do say it is covered. I've had it covered once, and it actually was covered for one patient. I shouldn't say just once. My office manager was still concerned about getting take-backs. Now, I may be a little overprotective with this, but that's just the way I feel, and I am concerned about having to give back all of this revenue that insurance might be paying in the future if they don't pay. So I'm a little bit concerned about doing this for patients and having insurance cover it when it's still kind of a temporary code. I think probably in the future it will be covered, and I think if people are selling it based on its coverage potential, I just feel like that's a slippery slope. I am not doing it covered. I'm doing it all self-pay, and I do quite a bit of it. So whenever you hear my podcast and I'm talking about Shockwave, these are all, I'll tell you if it's ever covered, but most of the time it is a self-pay type of a thing. So then they asked, well, which device would you get? So I think if you only want one device, I think the Shockwave is perfect. I think it's a little bit more expensive than, for example, the 2 Stort systems, the radial and the focus. But if you only want one system, I think the Shockwave is a great system. I have one Shockwave and I have 2 radial, which is a Storts, and then 1 focused. So the way I talk to patients about, I have radial and then I have non-radial devices. So I usually do both of those on every type of a patient. Okay, so I think those are another good option for you. If you want to get a device, I would start and just kind of get used to it. But be careful what the reps say, and I would actually talk to doctors that actually have the machines and see how they are doing, and maybe even visiting them. I've invited a lot of doctors to come and visit me in my practice to see what it's like, to do Shockwave, if they want to learn my tips. So if you want to come and visit me, shoot me an email down at podiatrypracticemastery.com. I have people, usually one person a month comes and visits me, and it's always nice to have them. Okay, so we talked about Shockwave. That was the other question. And I guess the last question they asked me is, well, what do you think about all these knockoff type of Shockwave devices? I had a doctor come and visit me, and he brought this one that he bought in China for $500. I tend to think you get what you pay for in terms of Shockwave devices, and really right now there's radial, there's non-radial, and then there are these EMTT devices and some of these other types of devices. They're not all kind of created equal. I find in my practice it's working best radial and non-radial. I don't have any of these other devices, but if you're going for a cheap device, you kind of get what you pay for. So I would kind of be careful with that, with going cheap with your Shockwave machine, because it's going to be a tool that's going to produce you so much revenue, and you have to be kind of proud about it. Someone has to be able to fix it if it breaks. I guess if it's $500, you can just buy other ones if they're cheap. Anyway, those are my thoughts. I hope you guys found this beneficial. If you haven't downloaded my $1 million blueprint, go to podiatrypracticemastery.com. Download that. I think it's really going to help your practice. Okay, thanks.